Hello, everyone. I'm Michela Riceputi. I'm a psychotherapist and I work in Milan at Niguarda Hospital. Today, I would like to show you our reality. We are the Centro Vittorio Di Capua Equestrian Rehabilitation Center. We offers equine facilitated therapies and as part of a national healthcare system. So today I would like to present you the way we work. The Vittorio Di Capua Equestrian Rehabilitation Center is an outpatient therapy service harmoniously integrated in the hospital grounds that was founded in 1981. Currently, we are part of the Childhood and Adolescence Neuropsychiatry department, and our center promotes and offers equine facilitated therapy to children with disabilities. Our center is created in 1981 in order to conduct therapeutic programs with animals, in particular with horses, and our center mainly treats patients from 2 to 14 years old with various neurological, orthopedic, and psychiatric disorders, but also assists adults recovering from, for example, amputation, burns, and brain damages. Our purpose is to offer people with disability the possibility to make better use of their existing healthy capabilities and residual potential. Now, I would like to show you a brief video that helps you to understand our reality and imagine our work. So Here there is an important part that I would like to show you because in 2015 the Italian Ministry of Health published the national guidelines with the purpose of regulating several matters relevant to these specific areas of intervention. So our center is recognized at national level as a specialized center that can provide equine facilitated therapies. The national guidelines were issued to supervise different areas of assisted intervention with animals. For example, education with specific and structured programs. The professional involved that need a qualifying certificate to work in this area, and obviously an importance to the animal eligibility. The Ministry of Health identifies 3 different intervention areas: therapy, assisted therapy with animals, assisted education, and assisted activities. Obviously, our center is located with the area of therapy. Each area has some particular features and characteristics. In particular, therapy needs to have healthcare professionals, for example. Our center is the only center that offers equine facilitated therapies inside a hospital facility. And our center is the only one that is physically located inside its operating area. I would like to point out as therapy provided by our center are free of charge for our patients due to the fact that our regional healthcare system recognizes the equine facilitated therapy as a therapy and takes charge of the family's expenses. So I would like to underline this particular aspect because I understand that in this Congress is a particular matter and is an important information that I would like to give you. As you could see in the video, our center is a particular center. It's inside an hospital, but it seems like a farm. Every space is thought to and designed to forget to be inside the hospital, and is constructed for little patients. We have 7 horses, but as you could see, we have also other animals like a goat or ducks. This is a particular element. As you can see, we have 2 different multidisciplinary teams, a clinical team and an animal team. So each team focused, for example, clinical team on the patient, obviously the animal team on our horses, and is characterized with different professionals. In the clinical team, we have project managers and therapists. Every therapist is a healthcare professional, and we have different competencies. In the animal team, you can see that there are different operators with different competencies, and the goal is to guarantee the well-being of the animal, and also in the clinical team, the well-being of the patient. I would like to underline that these 2 teams work strictly and daily, and are daily integrated to cooperate for a high level quality of our intervention. In this slide, you can see that our patients have this age 6 to 10 in particular, and our patient is the scholastic segment, and the pathologies involved are either motor and psychic, but with great prevalences for autism spectrum disorder. At our center, the patient undergoes a medical assessment by the team who develops the treatment program, sets the targets and monitors them through clinical and instrumental procedure. So in the first visit is made by the doctor in charge and by the therapist. A complete medical history is taken, and a clinical examination is taken, and also very important, there are the elimination. The doctor has to eliminate the treatment side effects that is carried out. So these are some side effects, and important are also the precautions in these particular cases. So after the first visit, we start an assessment cycle, 4 or 6 assessment meetings to record the patient's functional profile, to understand his needs, identifying talents and issues on which to build an intervention project. We work either with the horse and either in the room, and we use evaluation instruments, for example, video recording protocols, but also standardized tests. And after this cycle, the team is reunited, and there are sharing moments with different professional figures that has the aim of setting an individual rehabilitative project with short and long-term targets. There is a moment after this multidisciplinary team meeting to return with the parents, with family, to return and sharing moment with the family about the rehabilitative project and target. Here you can see some pictures of this assessment cycle. The activities are so various. So after this meeting with the patient and with the family, we start assisted therapy course with the horse, and the frequency is generally weekly. We work with the horse, but also we have some occupational activities on the ground. Every 6 months, we organized an equipe discussion, so an update with a visit with the parents. And the discharge is decided when we agree that targets achievement pursued and the equation-assisted therapy are finished. Here some pictures of activity with the horse, but also activity, occupational activities on the ground. So our center, the main purpose of our center is to offer equine facilitated therapies, but we have a large range of activities. For example, scientific activities. We participate in international congress as, for example, Haiti. every 4 years. We publish some scientific articles. We have published a book about our experience and about equine facilitated therapy. So here you can see some posters and our participation to Dublin Congress of 80. We work also in the area of education. So we have teaching contract with university, and we have educational courses relevant to the national guidelines. So our center organized formative courses to create and to prepare new professionals that would like to work in the assisted intervention with animals. Here some pictures and the plan of our courses. An important part of the center, our center is a medical center, but we have, there is also the association Amici del Centro Vittorio di Capua that was established in 2002, whose main purpose is to support transversely all the center activities, for example, our participation in this Congress. Also, the association have a large range of activities organized for our ex-patients, integrated sporting equitation with the children of the Niguarda Center. Organize integrated sporting vault and also animal assisted intervention with other animals, for example, cat or dog. The association organized in particular a school visit for our patients. So these are some pictures of our the activities of the association. I would like to thank you, and I hope that my presentation helps you to understand our reality. If you need some information, more information, or if you have some curiosity, you can write to this address, and I would be pleased to respond to you. Thank you very much.